I believe one of the essential pieces of advice that have been useful in my life in determining whether or not I have, a disease or something that I need to be thinking about is often whether or not it's lasting for 2 weeks. And this is actually a common definition of chronic symptoms in general. If we can figure out how our body feels and get attuned with really how we're wanting to feel, we can figure out what it is by process of experimentation, whether or not it's something weird, something new, or something that's happened before. And so my name is Dr. Turab Rai from Franklin.DentalCare and Dentures. I wanted to talk a little bit about emergency treatment and what many of you might be going through on those occasions where you wake up in the middle of the night and something is just not right, and you know that it's going to affect your next day and you might have a stressful thing coming up. There's a lot of circumstances that we see at the practice here that people are simply at a loss of where to go. We can see you within a week. If you have Medicaid, if you have a cash paying patient, please come on down. We'll take a look and we'll solve your problem that day if possible. Most of the time, however, what ends up happening is people come in expecting to get their tooth taken out, and I just want to educate you guys on why that might be difficult at times. If you have an infection in a tooth, what ends up happening a lot of the time is that infection will not let the anesthetic actually sink in to that tooth, and it'll make the extraction process or whatever we have to do a lot more difficult. So what we end up doing is providing antibiotics, having a week or 2 weeks, however long the next closest appointment is, of y'all being on those antibiotics and then coming in and getting that problem taken care of. The first appointment at Franklin Dental Care and Dentures tends to be a very quick 15 to 30 minute appointment of just us telling you really what we're seeing, what we suggest, and having that conversation in terms of where you want your ideal health, your ideal smile to be. And so emergency care in general comes down to posing experiments and understanding what has changed in life. This is a really, really valuable life skill that I've picked up by virtue of moving a lot and really taking into account the little details as dentists do a lot. Just making sure if you ate out somewhere strange, or if you're eating a certain thing more than often, more than usual, if there's an amount of sleep that's lacking that can lead to more stress, perhaps issues with our joints and our bone structure and our muscles over here when we wake up in the morning. These things are solvable by really just changing habits a little bit. And that's always what I stress. The two main things for your oral health to be consistent and for you to take care of yourself without, in a situation of apocalypse or where you can't get into the dentist very often, really come down to what we're doing daily. So I always tell patients it's 50-50. You got to have the hygiene. You got to make sure to brush those biting surfaces in the back of your mouth consistently. Those are the surfaces that I see the most amount of cavities on, and making sure to brush that gum line area properly so we can get rid of that plaque and calculus that ends up getting rid of that bone and making the gum look all red and bleedy. And half of that is hygiene. Half of taking care of ourselves is hygiene. The other half is nutrition. And I just want to go into this really quickly. Nutrition in general is something that's really overlooked, and I've seen in particular in Ohio, it's very strongly overlooked by the population that we see all the time because, well, we haven't been given that opportunity when we're younger to eat those vegetables and maybe have access to fruit or have access to good habits. Main thing is, I say, I don't care what you eat. I know life is hard, right? Things evolve quite a bit, but I do care about how often you are eating, mainly because the bacteria in our mouth are constantly alive. They're constantly kicking. They're really good for us, but if we overfeed them, if we spoil them, they can be quite bad for us. My personal thing that I've figured out in life is anxiety and depression are a product of having a highly successful society. And you might not think that, but I genuinely believe that we're in a place now in life as humans where we really have a lot of access to things that we've never had access to before. And what that means is we have the potential for a lot of free time. And we have the potential to get into potentially stressful relationships, stressful scenarios in life that really can make all of the difference in terms of, well, how we feel on the day to day, right? How we carry ourselves, how we end up making choices. And stress and anxiety play in a lot of ways, because when we're stressed out, when we have difficult scenarios that are presented to us, it's often hard to concentrate on our direct health. And I tell you, from a lot of soul searching and a lot of research, that really what comes down to what it comes down to when it comes to longevity of health, to enjoy life, is really being able to love ourselves first. I have this joke that we have a higher propensity to love our pets more than we love ourselves. We take them to the vet, we take care of our children a lot of the time more than we take care of ourselves. But I say to you, why not take care of ourselves the most? Why not give ourselves an opportunity to make the very most out of what we give ourselves? Why not have food that we eat all the time that's actually good for us? Why not have opportunities that are not so stressful? Why not separate ourselves from that life that might be too difficult to handle right now, and make sure that we're putting in the ample amount of work that is required to actually avoid stress. The reason that I'm talking about stress and anxiety so much is because really when we can mitigate that, it's not just about the mouth, right? The mouth is a portal to the body. And when we can mitigate that overarching thing that affects every aspect of our system, we can actually end up solving a lot of the preventative health issues that could end up having us feeling a lot better consistently, and actually showing up for our families, our friends, our jobs, the things that we're really passionate about, with more energy and more enthusiasm, because we delayed that gratification. We said, no, I'm not going to have that pop, I'm not going to have that energy drink, I'm not going to have that cigarette, I'm not going to smoke that vape, and I'm going to try really, really hard to become just a little bit better every day, and live with a sense of purpose. If you want to come on down, if you're having pain, or someone that's having pain and you need them to be seen that day, or if you need them to be seen that week, give us a call. I'll leave the information down below in the description. Hopefully this video helped you. Smash that thumbs up button if it did. I'd love to have you come over to the office and have some awesome conversations. Also, the Turabify brand is available. It's Turabify, Turabify, on YouTube and all of the other social media platforms. If you're looking for a little bit more help on the personal side of things and actually figuring out how to utilize all of these amazing contacts and opportunities that are available to you. Anyway, take care. This is Dr. Turab Rai from Franklin.DentalCare and Dentures. And right in the background, this is Dr. Taj. Take care.